Well, it's 12:30 and I can see that we've got participants starting to join us for today's webinar. So obviously this week is Rabbit Awareness Week and we are hosting this webinar to coincide with Rabbit Awareness Week. Supreme's proud to sponsor this with Molly Varga and Craig Tessyman, who have spoken for us on many occasions. And we work with Molly and have done for many, many years. And just kind of in line with our Science Selective Food for Life campaign, we wanted to focus on feeding rabbits for health and longevity. So I'm pleased to welcome Molly Varga and Craig Tessyman. Thank you everybody for joining us for today's webinar. Molly, I will hand over to you.
Okay, thank you very much, Claire. So to start with, I would like to introduce Craig Tessyman. Craig and I have worked together now at Rutland House Referrals for about 7 years. Craig has his advanced certificate in zoological nursing and his diploma in zoological nursing as well. And as I say, together we launched and now work within our exotics department in Merseyside.
So yeah, I'll introduce Molly. I've known Molly, I don't like saying this, for 25 years now. Molly was one of the so long. Molly was one of the very first vets that I got to do experience with before I became a veterinary nurse. And then 7 years ago, our paths crossed again and the opportunity came to set up the exotics department within this multidisciplinary referral hospital. So we see everything that is a non-domestic, which is an exotic species, so can commonly not kept. So anything that isn't a cat and a dog, unless it's a special type of cat and dog. So we see wolf dog hybrids and we see some savannah cats. So we see everything and their cousins. Molly gained her RCVS Recognised Specialist status in zoo and wildlife medicine a number of years ago and has contributed to a number of different publications. And she is the author of the Rabbit Medicine and Surgery textbooks, which are third edition has just been released. Yep, third edition has just been released.
Okay, thank you, Craig. So I think we need to start at the beginning and think about what we, as you know, rabbit keepers, as rabbit medicine workers, as nurses and vets, have really started with rabbit nutrition. And, you know, we have come a long way. The original research about rabbit nutrition was actually realistically done to allow rabbit meat production. And what this means in a physical sense is actually when we started to think about how we fed rabbits, what we wanted to do was to feed them for rapid growth and for a large amount of meat with a suitable amount of fat on a carcass. And this is quite obviously something that is actually really not based on these animals having either a long or a healthy life. Now, as we've started to shift our focus away from meat production, certainly in this country, and certainly perhaps more in the US as well, what we're looking for is a different paradigm. We need to feed these animals differently because our expectations are increasing. We are looking at rabbits perhaps living 10 and sometimes even 14 or 15 years. So these animals are long-lived. And what we need to do is to make certain we start off right and allow them to achieve a good quality of life for as long as possible. And as I say, this is certainly something that owners are very, very interested in. Now, what we need to do, and we'll repeat this point periodically throughout this webinar, is to understand that actually there are various different ways of feeding rabbits, but rabbits should eat hay and or grass as the main portion of their diet. Personally, I find that if we feed rabbits hay and grass, a portion of a variety of mixed green veg, and a core of a good quality pellet, the amount varying with age, the type of pellet varying with age, this gives us a really practical and useful and safe way of feeding rabbits that will support health and will support longevity. And as I say, nutritional requirements can shift dependent on the animal's age, dependent on production. And by production, I mean, is that animal breeding, reproducing, that type of thing. So where we need to sort of act on the elephant in the room is actually, do we need to feed pellets? And again, we'll come back to this point. And in some situations where we have owners that have access to suitable forage, where they're willing to organise appropriate veg only, then maybe we can reduce or stop pellets. But for most people in most situations, this ends up not being appropriate, simply because many of the vegetables that we can buy and access easily is not, they're not that appropriate. They're not equivalent to what rabbits would eat in the wild. So using the pellets to support that is very helpful.
So as Molly's just said, it's, do we need to feed pellets? Well, in the wild, wild rabbits would not get fed pellets, but their diet would change as the years move through. During our warmer seasons, so the end of the seasons we've got at the moment, our wild rabbits will be eating weeds, grass, clover. They'll be eating flowers that they can find, and they'll be eating vegetable matters and plants. We all know the many, many cartoon rabbits out there that go into the fruit and veg kind of growers areas and take all of them away because they're able to forage and go and find them. But these food types aren't available at all time. And as the weather changes and the weather starts to get cold, rabbits will start to eat some twigs. They will eat the bark from conifer needles, from the evergreens, and whatever green plants are still around at that time. So their diet changes during the times of the year. But we don't see certain conditions in wild rabbits that we do see in our domesticated rabbits. We don't see very many obese rabbits out in the field. We don't see many dental diseases from wild rabbits as well. And that is because their diets are changing, because they constantly eat this hard roughage. It keeps those teeth down, it keeps the digestive system moving quite well, and it keeps them nice and slim and lean. It's also down to the fact that rabbits are a prey species. Everything predates upon them, and they need to be seen to be the healthiest status that they can be, so they don't stay in one place and gorge on these vegetables that they found, or this fruit or the flowers that they found. They will move around a lot more, and they will have a much varied diet than what we've got. And it's, are we able to keep that diet as varied and as wild as what we do in the domestic setting? Next slide, Mel.
Okay.
Thank you. So for our domesticated rabbits, as Molly said, we want a good quality hay. We want many different varieties out there. You've got your Timothy hays, you've got your dandelion hay, and really it depends on what the rabbit likes. But we could also mix and change them around as well, so we're not staying with the same boring food the whole time and the rabbit gets bored of it. And that choice that we're then giving them means that they can choose what they want, and they can change and hopefully stop getting problems later on. Dark green leafy vegetables and herbs are probably better for them than any of your lighter green vegetables. They've got more nutrients to them, they've got more vitamins, which we will talk about later, and having a variety of them is available. And again, these are seasonal. Some of these items are not available right the way through the year. We want a good quality, specifically designed rabbit food. Muesli is available. Muesli was originally brought out to put weight on these rabbits and get them nice and big and chunky and fat. And that is a complete diet. If we can get the rabbit to eat all of that diet, they have to eat all of the small grains in the bottom of the bowl, as well as those biscuits and those dried foods that's in there. The benefit of using design food, a complete diet, is there is no selective feeding that happens. So the rabbit can't choose what it has. It gets all the nutrients on each bite and each mouthful that it has. And the problem as well with mueslis is they use lots of colorants, and they'll add sugar to some of the diets as well to make it more interesting for the rabbit so that they take it. And I'll always throw it in there when we do it to avoid carrots. Carrots are full of sugar. Bugs Bunny must have been diabetic with the amount of carrots that he ate. And it's not a good thing that they do. They wouldn't normally come in contact with the carrots because they're underground, but they would eat the carrot tops, and carrot tops are a really good diet for them to have. Next slide, please, Mal.
So realistically, the core of a rabbit's diet needs to be fibre. And often if you're reading around and looking on forums and reading around information about rabbits, rabbits are often called fibrivores. But really, what does that actually mean? And for your pet, for the rabbits that you are keeping or treating or otherwise managing or looking after, it means that they are reliant on fibre for their gut to work, for health and longevity. And we need to understand actually what fibre is. So fibre is the structural components of plants. It's what allows grass to stand up. It's what gives the texture to the leafy greens that we feed. And it is largely things like cellulose, other related compounds, lignin, that type of thing. And there are a variety of different types of fibre that are within the plants that we feed. Now, fibre is more problematic in terms of digestion. And generally, the sort of fibre that is digested will be digested by the intestinal microflora. It is not so simple as simply taking this food in and it's immediately absorbed by the gut like simple sugars might be. And generally, we divide fibre into two types. Digestible fibre, i.e. this is the shorter chain fibres, the more simple molecules. And these are the sorts of parts of the diet that will go straight into the cecum and be digested much more easily by the cecal microflora. And these will eventually become cecotrophs, of which more later. The other type of fibre is indigestible fibre. And this indigestible fibre is the long stem, very dense molecules that you can often see in rabbit hard feces. And once this fibre gets into the large intestine, it actually passes straight through. It does not go into the cecum for digestion, and it becomes part of, as I said, the hard feces. This type of indigestible fibre is absolutely crucial for the normal working of the rabbit gut. And we need to make certain that the balance between digestible and indigestible fibre is maintained so that the rabbits can get nutrition as well as good gut mobility. Now, the digestibility of fibre varies between plant species, and it also varies with the digestive physiology. So if we go off piste a little bit and think about other fibrivores such as guinea pigs and chinchillas, they have a slightly different mechanism and a slightly different capability of digesting fibres. But as I said, fibre, if you take one thing out of this webinar, is that fibre is the single most important core of the rabbit diet. So, as I say, fibre typically is digested in the cecum, and it is the gut bacteria that are the crucial point here. And as a rabbit vet and as somebody who has looked after many rabbits over many, many years, the one thing that we've become obsessive about is the gut microflora. And this is the combination of bacteria, viruses, yeasts, protozoa that sit in the cecum and give that rabbit, that individual rabbit, the capability to digest its food. Now, when we start changing rabbits' diet, the type of fibre that we feed them will slightly alter the conditions in the cecum. And this in itself will then alter the types of bacteria or viruses that thrive in that condition. And actually, this will alter the microbiome. So the microbiome is very, very responsive to the food that we feed an animal. And this is one of the reasons why we actually kind of need to be a little bit careful about how rapidly we change the diet. Now, I think the microflora, as I said, is an absolutely crucial part of how well a rabbit will do over its lifespan. Now, when we're starting to talk about the types of fibre particles of about 0.3 millimetres or less will tend to get into the cecum. The larger long stem fibres absolutely will become the hard feces. And certainly once we are starting to look at these tiny particles, these are the things that the bacterial or viral or yeast particles can actually work on and can start to digest. And the chemical structure will inform us how easy it is for a certain type of fibre to be digested.
Yay, and I get to speak about poop. So we talked about the fibres that have gone through the system and how they've gone through there. But once a day, rabbits will actually eat their own droppings. These are what are known as the cecotrophs. The body normally does this. It's either dusk or dawn. Sometimes it's both in some rabbits. A lot of domesticated rabbits, you will see that twice a day. And it will look like they're grooming and they're just cleaning around their back end. And what they're actually doing is they're eating the cecotrophs directly from the rectum at that point. And we need to be very careful. We know the difference between what is cecotrophs and what is diarrhea, because diarrhea is completely different and we need to be more concerned about things like that. But cecotrophs look like very shiny, very soft kind of bundles of grapes that come out all together. And the reason that rabbits eat those cecotrophs is because their digestive system is terrible at digesting fibre. It takes all of these long chains on, so sometimes we just need to take those fibre molecules in twice and we bring those back into the system. And these cecotrophs then go in and they're digested through the cecal wall, as Molly said. Cecotrophs have more protein in them. They've got a lot of vitamins that are still left in there, and that's why we have to eat them through, but they've got a lot less fibrous than our normal feces. Our normal feces that we're looking for, we want a rabbit that's eating lots of hay, we want them eating lots of grass, we want them kind of golden in colour, we want them quite crumbly. If we've got rabbits or if we're treating rabbits, we know that a rabbit's main job is to eat and to poop. That's what they do constantly. And it's this constant cycle that goes through. And we want to be careful that there is no break or gap or kind of stopping of this system actually moving through, because we may end up with something which we call gut stasis, which we will talk about later on as well today. Next slide. So we've talked about digestible fibre. Now we need to tackle the indigestible fibre. And there are various reasons why we absolutely still have to have this. It might seem actually that, you know, it might be easier to just feed rabbits on something that was easily digestible. However, rabbits being rabbits, it's not quite that simple. So there are several reasons why indigestible fibre is also a critical part of the diet. And I think the first thing is dental wear. Now, we all know that rabbits' teeth grow constantly, and they grow constantly because they have evolved to deal with a diet that has a high amount of indigestible fibre. And this fibre needs to be crushed up and the insides of the cells opened to allow any kind of digestion at all. So as soon as we don't feed indigestible fibre, then we run the risk of the teeth elongating and potentially causing spurs and resulting in acquired
dental disease. And this is certainly not something that we really want to go down with any individual rabbit if we can avoid it. So feeding indigestible fibre will promote good normal dental wear and will reduce the likelihood of acquired dental disease as long as other factors don't intervene. I mentioned earlier that indigestible fibre is also quite critical for promoting normal gut mobility. And again, it is the long stem fibre that actually stimulates the gut movement, the peristalsis, to produce the normal droppings, and it also stimulates the periodic reverse peristalsis, which allows the digestible fibre to go back into the cecum and microbial digestion and fermentation to occur. We've talked about these bits, but what about the other factors that, again, are useful in terms of indigestible fibre? I think one very important thing is actually having adequate fibre will reduce the intake of non-food items. Now, I quite often say, and it occurs on a daily basis, that many rabbits that come into hospital and we are watching them or we're monitoring what they're eating, a lot of them will want to start eating newspaper and shredding up their bed and that kind of thing. And what we want in the home situation is actually for most rabbits not to eat things like carpet or plastic and things like that, because again, that can cause their own issues. So producing a diet with sufficient dietary fibre will reduce that. It will also reduce the risk of things like fur chewing. So while not all fur chewing is down to a lack of dietary fibre, that is certainly one cause of it. And again, we've all seen, in those of us that are working in veterinary practice, we have all seen rabbits that have chewed and pulled out their fur. And, you know, we've wondered whether it has been a dietary origin. I think there are other things that we need to also consider. And again, the dietary fibre supports normal appetite, and appetite and food intake is very, very closely related to chewing, to swallowing, and to gut motility. So as soon as the rabbit isn't chewing, it isn't swallowing, the gut motility is much more likely to be reduced. As soon as the gut motility is reduced, the rabbit is much less likely to take in food voluntarily. And we end up with ever decreasing cycles of worsening gut mobility. And this is where we end up with gut stasis. And normal intake of indigestible fibre will support the appetite because it supports the gut motility, and it will support the production of cecotrophs because the production of cecotrophs is reliant on normal gut motility. Indigestible fibre will not affect the secretroph composition, but as I say, it does affect and promote the production of cecotrophs. Now, the recommended levels of fibre can vary, and it depends whether we're looking at growing rabbits, whether we're looking at commercially produced rabbits, whether we're looking at rabbits for lactation and longevity. And we're certainly starting to recommend in excess of 13% fibre for pet rabbits. And actually, in many cases, we're starting to increase that percentage of fibre within the diet to sort of 20 to 24% of the diet. And that is a significant amount of fibre. So we certainly need to, you know, keep these rabbits eating in order to achieve that aim. Now, Craig has mentioned carrots, and one of the issues that we can have with rabbits is over intake of simple carbohydrates. Now, carbohydrates are sugars and starches as well as fibre. Fibre is a complex carbohydrate. The sugars and starches are simple carbohydrates. And these are directly digested by enzymes in the gut, and they are then immediately transported across the gut wall and into the bloodstream. So their digestion is much more simple, much more rapid, much easier. And regardless of anything else, they are still a useful energy source. But, and again, there is a but. Now, in terms of rabbits, we've talked about carrots, and one of the issues we have with carrots is they're quite high in sugar and they're quite high in starch. Now, starch is broken down by an enzyme called amylase. However, rabbits don't produce a lot of this enzyme, and the activity of amylase is limited by the low acidic pH of the rabbit stomach. So rabbits do not have a good capability to digest starch directly. Now, what we also need to remember is that eventually the gut microflora will produce more simple carbohydrates secondary to the bacterial fermentation. And this is relevant now when we understand that actually cecotrophs, in addition to bacteria and more simple molecules, will also contain enzymes such as amylase. Now, what we do find is that rabbits that are fed a high proportion of starch in the diet will eat fewer of their cecotrophs. And the reason for this is twofold. Firstly, they're getting enough energy. They don't necessarily need the cecotrophs immediately. The second part of the reason is actually the cecotrophs taste different and sometimes can taste a little bit aversive. So from that perspective, we end up with cecotrophs being left, and that is obviously not ideal. And that is certainly something that can be mistaken for diarrhea in some cases. So it's something that we need to avoid. Now, having said all of that, we need to therefore understand that we need within the rabbit's diet to have a balance between digestible and indigestible sugars. And actually, we don't want to have a high sugar diet or a high starch diet whatsoever. And certainly in many cases where we see rabbits, rabbits that have just been weaned, perhaps just been moved from away from the mother towards wherever it is that they're being sold, whether this is by an owner with babies or a pet shop or a breeder, we see those animals get a little bit stressed, and it's very typically those animals at that kind of age with a high carbohydrate, low fibre diet where we get the quite serious diarrhea or enterotoxemia. Now, other things that we need to consider within the diet are things like minerals and vitamins. Now, calcium is certainly something that we have talked a lot about with respect to rabbit diets over the last 20 years. And certainly at one stage, low calcium in the diet was thought to be one of the causes of dental disease. Now, calcium is one of the most common minerals in the rabbit's body, in any body. It can, it's a constituent of both teeth and bones, and it's also a requirement for muscle contraction, gut motility, heartbeats, all sorts of different functions. So it's certainly something that is very, very important to have within the diet. It's worthwhile noting that calcium metabolism in the rabbit is not that straightforward. And there certainly can be misinterpretation of some of the data in terms of, how much calcium is required. And we know from the original nutritional research that at least 0.22% of calcium as dry matter within the diet is required to support normal growth. And higher percentages are needed for bone calcification and, tooth production. We do know that rabbits in general need approximately 0.6 to 1% calcium in the diet. Now, what we don't want is to have too much calcium in the diet. And I think most vets and nurses, and certainly most savvy rabbit owners, are very aware of the risks of over-supplementation of calcium within the rabbit diet, as well as over-supplementation of things like vitamin D. And we'll come to that in a minute. And what we don't want to cause through the diet is a risk of having a lot of calcium being removed from the body through the kidneys and then through the urine, resulting in potentially kidney stones, bladder stones, and certainly very commonly bladder sludging. Now, we find that as rabbits age, while they have a core requirement for calcium, things like reduction in renal function because the kidneys are working less efficiently as a rabbit gets older, and also a reduction in physical mobility as rabbits age, can both impact the ability of an animal to safely get rid of the calcium that it doesn't need from the diet. And as I say, the consequences of over supplementation from calcium are things like bladder sludge and soft tissue calcification. We see calcification of things like the aorta, which actually can be quite significant, as well as things like kidney stones. So we need to be aware of the calcium levels within the diet and provide enough, but not to over supplement it. Now, I think other minerals are quite often forgotten because we're all so focused on, not wrongly, but we are also focused on calcium. But it's worthwhile noting that calcium, phosphorus, and actually magnesium are all quite closely interlinked. And in some ways, we are less informed about how phosphorus is regulated within the body. We're certainly less informed about the precise role of magnesium in rabbits. We know that over supplementation as well as under provision of phosphorus, potassium, magnesium, and sodium and chloride all can cause negative effects within our pet rabbits as patients and as pets. And this is one of the reasons why I certainly advocate using a good quality pellet as part of the diet, because we need to worry less about over provision of some of these minerals, as well as under provision of some of them. It gives us a safety barrier, if you like, to causing problems through the diet. So, protein. Now, I think we think less of rabbits as protein eaters. However, they all, regardless of needing fibre and other things within the diet, do have a requirement for protein in order to produce amino acids and to allow for growth, for pregnancy, for lactation, and for those rabbits that are being used for this purpose, the production of meat and wool. Now, rabbits, again, as always, are a little bit more complex than perhaps more simple animals like dogs or rats or humans. And they do require a certain core of essential amino acids within the diet. However, some of the organisms within the microbiome can also synthesize amino acids. So again, in some ways, it can be easier to fulfill their protein requirements. Now, within the rabbit diet, we are not talking about providing protein from animal sources whatsoever, and we are certainly very against any kind of animal product being within any part of the rabbit diet at all. And plant-based proteins are typically found in the leaves of plants or within the seeds. Now we'll put seeds to one side a little bit, because there is certainly quite a strong movement against grains or seeds within the diet. However, rabbits in the wild will take in seeds at the appropriate time of year when they're available as part of their diet. So from that perspective, we need to just kind of have a balanced view on that. But most of the proteins within the rabbit diet will come from the broad green leafy vegetables and the protein contained within grass and within hay. And as with all of the other food components, we certainly have a view on what the optimum protein levels are for certain life stages. So for growth, it might be quite a high protein level. For pet rabbits, we may be looking at a slightly lower protein level, so that we don't put undue pressure on the kidneys, because the kidneys, again, are tasked with the removal of protein byproducts from the body. What happens if we overfeed protein? Well, again, too much protein will reduce that rabbit's need to eat its cecotrophs, and it will increase the production of things like ammonia as a byproduct of protein digestion. It will also affect the pH of the cecotrophs, and it will affect how they taste. And a combination of this will stop that rabbit eating the cecotrophs as much as they ought to. In very severe cases where far too much protein is fed, we can promote the overgrowth of pathogenic bacteria in the gut. And all rabbits have some of these pathogenic bacteria, but they're kept under wraps by the good bacteria. However, if we really change the cecal contents, then the pathogenic or damaging bacteria can overgrow, and that can cause severe diarrhea and sadly even death in the longer term. Now, fat also is a crucial part of the diet, and again, fat is a reasonably simple component to digest and absorb in the body. It's absorbed in the stomach and the small intestine, so we don't worry about the large intestine or the cecum in terms of that as much. We need fat to be able to absorb things like calcium and some vitamins normally, so we certainly need a background amount of it within the diet. It can be used as an energy source, and sometimes this is quite useful when we need to limit the other energy source, which is simple carbohydrates. Fat within the diet will promote gut motility to a degree, and it's certainly, as we probably all realise when we think about donuts versus broccoli, fat will actually certainly improve the dietary palatability a little bit. However, again, what we don't want is a high fat diet where rabbits can easily become overweight and can have fat deposits within the liver. Now, hepatic lipidosis is the condition where there is over storage of fat within the liver. And what that does is it actually affects the liver's ability to do its normal job. So again, we need to be reasonably careful with the amount of fat within the diet. And you'll see here that the fat percentage in the diet here is relatively low. So up to 4% for growth or for reproduction or milk production. And then finally, talking about dietary components, vitamins. And we have two types of vitamins. We have vitamins A, D, E, and K, which are fat-soluble vitamins. And we have vitamin B and C, which are water-soluble vitamins. Now, vitamin A is only found in animal tissues. We see precursors in plants. However, the precursors can be formed into vitamin A within the cecum and will therefore be found in cecotrophes. So we do not need to feed animal-based products in order to satisfy our requirement for vitamin A. Vitamin D, as we know in mammals, typically is synthesized in the skin in response to exposure to sunlight. And again, precursors based on plant products are found in the diet. Vitamin E is very commonly found in leafy greens and cereals. So again, very common parts of a normal rabbit diet. Vitamin K, luckily, is produced quite frequently by the microflora or the bacteria in the cecum and is a common constituent of cecotrophes as well as vitamin D. So we have a way of getting all of these vitamins in quite nicely. Vitamin B complex vitamins, again, are produced by cecal microflora and are very high concentrations in the cecotrophes. And vitamin C is synthesized from glucose by the liver. So lipidosis in the liver can affect vitamin C production. And if you have a rabbit that has lost a lot of weight and is likely to have a fat within its liver, we may need to supplement vitamin C with some of those animals. And this is why animals, rabbits that are unwell, may need a higher level of vitamin C within the diet.
So as well as all of the vitamins and minerals that we need, water is extremely important. Water makes up probably about 80% of the constituency of a rabbit, just like it does in humans. And a normal intake for a rabbit is a lot greater than what you would think. It's about 50 to 100 mils per kilogram per day. That's normal for a rabbit to take in if they're eating a lot of dry material. They may not drink that volume because they may get some of that water content from the vegetables that they're eating as well. Rabbits are very small skeletal systems inside of a big kind of fluidy kind of body which is inside of there, so they become dehydrated very, very easily, and the intestines and the gut motility is really necessitated by needing the water on board as well. So if rabbits will go off their water or they've not got access to water, they can become dehydrated very quickly, which then makes their gut motility slow down. It will stop the fecal production and it can cause much worse problems leading forward. Historically, rabbits were fed with a water bottle, and we think that was primarily down to the meat trade where they were being grown and they were used for meat. But a rabbit in the wild will eat with its head on a downward angle, so giving a water bowl is something which is preferred by most rabbits. In practice, in veterinary practice, we always offer a bottle and a bowl, but we will always ask the clients as well. But we normally find that even rabbits that will drink from a bottle, if we offer them a bowl, they will drink and they will lap quite quickly, and quite a lot of water will be taken on at that point. Next slide, please. So how much are we going to feed a rabbit? There's what we call the maintenance energy requirements, and the maintenance energy requirements for rabbits is about 100 kilocalories per body weight to the power of 75. So it's a weird mathematical equation which we need to work out, but we need to give for growth for our younger rabbits and for our juvenile rabbits, we need to kind of give twice the amount of energy requirements that they need to maintain growth to get them through that. And our rabbits that are carrying young, or they're lactating, if they've got young there, they need a much higher level as well. They need about twice as much on the maintenance. But what we're going to feed them, ideally what we want our rabbits diet to be is about 85% grass and hay. 10% of that can be greens, 5% a pelleted diet, and maybe 1 to 2% of that diet can also be treats. We're not going to stop them. We're not going to say that they can't have them at all. But how do we do that kind of visually? The easiest way to do it is if you give a body-sized amount of hay, a head-sized amount of greens, and an ear-sized amount of the pellets. It's kind of the right way to do it. It's difficult in some of our species. Our lop rabbits have got much bigger ears, so we need to maintain that. We're keeping that about. And then treat-wise, about the size of your nose, a little cute amount that we need to give, so we can give some treats and things that are on there. Next slide, please, Mo. So are we going to feed them muesli or are we going to feed them nugget? So most foods in the UK, as we said earlier on, are balanced. And if they're fed correctly, if the rabbit eats all of the food, if they eat everything you put out in that bowl, it is a balanced diet if you're giving them a muesli. But I'm going to shoot into the dark now. I've been doing this for a long time. But most owners and most veterinary professionals as well, we will look at that food and we'll say, oh, those little bits at the bottom don't look very appetizing. And we throw them away and then we top that bowl up again. And the rabbit goes straight over and picks out the colored pellets that it likes or the bits of dried banana or whatever it's found that's in there. Pelleted diets give a much more balanced nutritional kind of mouthful of every mouthful that rabbit takes on. But it doesn't allow for selective feeding where a muesli diet does. Rabbits, they select what they want and they'll choose the foods that are higher in the nutritional value that they want to eat, but they'll also go for what's most palatable, what's sweetest, what tastes the best for them. And some of these small little bits in the bottom of the muesli, they're not very interested in. So by using a pelleted diet, we're getting the nutrients in every single mouthful, and we're allowing them to do the select feeding of the other food which are available as well. So they will then choose to eat their greens, they will then choose to eat their hay, and they won't be going through and filling themselves up. It's a little bit like, I've not got children, but I'm guessing with children, if you give them a lovely big box at the beginning of the day and it was filled with all of the food for the day, and there was some sweets in there, but there was some broccoli and there was some salad, they will eat the sweets first and then they'll eat the broccoli and the salad at the very end of the day if they're feeling hungry. So rabbits will do exactly the same. There's no difference in them at all. Next slide, please.
So what are we going to translate all of this kind of technical information into, and why is it important? So for young rabbits, I think this is one of the most important times. And this is where an animal's food preferences start to be set. This is where its multibiome starts to be set. And we have to remember that all of the intake through the gut, everything that a juvenile rabbit takes in is used by the gut to stimulate its immunity in the longer term. So actually the gut is integral in allowing an animal to have a robust immune system, to not be susceptible to snuffles, to other kinds of diseases. And it's actually, as I said, an incredibly important time. Now, the food preference will likely depend on what is around a juvenile rabbit when it starts to eat hard food, and it shifts from being a simple gutted animal that is drinking milk to a complex gutted animal that is reliant on fibre. So that is when that animal learns what it should and can eat. And this is then, in turn, what stimulates the type of bacteria, yeast, fungi, viruses that are sustained within that animal's cecum. And to an extent, that will also depend on the mother's gut biome as well. So the more robust the mother is, the more robust the young are likely to be. And this time of weaning, when baby rabbits transition quite radically from drinking milk to eating the wide variety of high fibre foods that we expect our adult rabbits to eat, is a real time when they can be quite vulnerable. So it is a time where actually we need to be very careful with the diet. And it's certainly a time where we can see things like coccidiosis, which is an overgrowth of single-celled organisms called Eimeria, which can cause diarrhea. We also see mucoid enteropathy and other stress-related diseases that manifest as mucus in the feces or diarrhea. And this actually can be quite a significant problem. So what do we physically need to do? We need to allow this young animal to expand its diet safely. And absolutely, we need to provide ad lib, good quality hay, appropriate quality hay. Ideally, in my opinion, we should also offer an appropriate life stage pellet, so something that is suitable for young animals. And we need to remember that with young animals, that might need to be a slightly higher proportion of the diet than we would use for adults. This is a time where you should then start to introduce a variety of fresh greens. And what I tend to advise people to do is to offer a small amount of a single type of green sort of every day. And over time, you can expand the variety and the number of different types of greens that you offer at any one time. However, remembering what we said right at the beginning, that the gut biome is very responsive to the diet that is fed, and we need to respect that it will need some time to adjust. So do this slowly. Don't ever change the diet rapidly, and particularly not with a young animal. Now, the next step for most pet rabbits after sort of coming into the home and the diet being expanded is neutering. And we will talk about dealing with that in hospital shortly, but we certainly very much advocate neutering. And I do believe that it does benefit the pet rabbit as an individual, as well as a pet rabbit within the population. Now, we neuter most rabbits between 16 and 24 weeks of age. However, there are exceptions to this. So very tiny individuals, such as Netherland dwarfs, may need to grow a little bit more before we're comfortable neutering them. And the giant breeds, so for example, continental giants, French lots, that kind of thing, may actually not be mature enough at 16 weeks of age to neuter, and we may need to wait until they are mature, even though they're a lot larger. Once we have neutered that animal, the requirement for calories will reduce, and neutering significantly adjusts the individual's metabolic rate. So each animal after neutering will require fewer calories to maintain its weight. And you'll quite often notice that a rabbit that hasn't been neutered feels very lean and muscular. Rabbits that have been neutered tend to be a little bit less muscular and can have a little bit more body fat available. This is the time where we need to consider a change to an adult diet, an adult-based pellet, or a pellet that is suitable for neutered or house rabbits. And again, they will have the calories adjusted within them so that it's more appropriate for the life stage of the individual. But as always, the story does need to be that we will offer ad lib hay and a variety of fresh vegetables in order to balance out that diet and make that as appropriate as we can for that life stage. Now, adult rabbits ideally should be on a maintenance diet. In most cases, you don't want them to gain or lose weight. And it's a time of consolidating your good habits, allowing the work that you've done from the young rabbit through neutering to the adult stage to allow that animal to have a long period of time where it's healthy and well before we need to worry about different life stages. And the key point at this time is balance. We need to make certain that the hay intake is maintained so that we have good tooth wear. We need to make certain that this animal does not become overweight and affect its mobility and things like its ability to get rid of calcium in the urine. So again, it is very much a balancing act, but it shouldn't be a knife edge, and hopefully this should be a long and enjoyable stage for both yourself as well as your rabbits. Now, increasingly, we are seeing rabbits that achieve 12, 14, and in some cases, we've had one rabbit that was 17 years old. So we are getting a lot of older animals. I think that we're not certain as definitively as we are with dogs or cats what actually a geriatric rabbit is. And I would say that sometimes you can see a 7 or 8 year old rabbit that is presenting as old, whereas sometimes you see a 10-year-old rabbit that is actually very sprightly and active. So there is a certain amount of individual variation. And it might be that, you know, with a giant rabbit, we're talking about a rabbit that is old, really getting old at about 4. So again, it's very dependent on the individual as well as the breed. And I think it's always sadly worth mentioning that, as with anybody, longevity isn't promised. And what we need to do is to try and support that as much as we can and take action, you know, proactively at this stage to try and promote the longevity that we can for the individual. So what do we need to think about? Well, we need to think about avoiding weight gain. A lot of these rabbits are less active because they've got arthritis or other issues. The metabolism will slightly slow down as well. That means that realistically they will need fewer calories. However, they still need enough protein, enough fat, enough nutrients such as vitamins. And some requirements will increase in the older rabbit. And this means that it is worthwhile, again, looking at and choosing a formulated diet that supports the aging process, as well as offering these rabbits access to hay and access to fresh vegetables. And it might be as pets get older, their willingness to put a lot of energy into eating, and certainly hay and that kind of thing, has been affected by dental disease and what have you. So again, it does become very important that we support the diet for these animals at this time.
So food can also be used as an enrichment to keep your rabbit moving. As we said, with wild rabbits, they're constantly moving, they're constantly exploring to see what's out there and what's available. But house rabbits or outdoor rabbits, hopefully nobody's still keeping rabbits in hutches. We know the feelings and the kind of the rules on about hutches now, and that we should have much larger areas and much larger runs for our rabbits to exercise in. But that doesn't mean that they're still getting the exercise that they require. And doing something as simple as what's in the image of hanging fruits and veggies and up on a small washing line, so the rabbit has to reach up to actually get this food. They would be doing this in the wild if they were eating greens from low bushes or from plants that had grown up. They would be eating from kind of a more of an upright, Scott, from more of an upright stance rather than having their head down all the time. Also hiding food, encouraging exercise, and investigating, hiding some of the favorite food. If you know that your rabbit is a big fan of, let's say, mint, something's got a nice smell, hide that in a rolled up ball of paper and hide that in somewhere in the house. The rabbit has to go and explore to try and find it. It improves their spatial awareness. They know what's around, they know what it is. It improves their psychological well-being because they keep being constantly entertained. They're not stuck in a small box all the time and just eating from the floor and eating from the same place. And even something as simple as scattering the pellets, not putting them into bowls all the time, just putting it, measuring out how much you're going to give and then scattering it through the hay and through the environment where they live, hiding it under bits of paper, hiding it under their food bowl and things, so that they have to actually look for these items and they'll be more entertaining. It'll keep their brain going. And as we know with humans, the younger the brain is, the younger the person is as well if they're doing more of these things. Next slide, please. So, as Molly said, we see rabbits at a lot of stages. We see a lot of young rabbits when they're in to be neutered, but we'll also see older rabbits right the way through to geriatric that might be in to see us with some dental disease. So we need to take into considerations about what surgery that the rabbits actually had. And we also need to take consideration of what the age is of these rabbits as well. And how do we actually get these rabbits back to a normal pattern of eating? Your vet will go through to make sure that your rabbit is in really good pain relief. Rabbits, as we said at the start, are a prey species. They hide everything from everybody. Molly will agree with me on this. We've had rabbits in that have the worst dental disease that we've ever seen. But when they're in hospital with us, we will sit there and we will watch them, and they will pick up bits of food in their mouth and they will look at you as if to go, look, I'm eating, I'm a really good rabbit. Where they're not able to eat, those teeth are not able to take those on, but they don't want the big scary humans, the predators, to know that there's a problem. They want to pretend that they're normal within a normal stance. So we have to also monitor them for pain relief. And when they're dehydrated and they've not taken enough food and water on board, and when they dehydrate and the stomach starts to slow down and the intestines start to slow down and the motility slows down, that's painful. That's like having really bad bellyache. So we will give rabbits analgesia to make them feel a little bit more comfortable and get that on board. We're going to give fluid therapy when rabbits are in with us as well, and your vet will do the same, because they become dehydrated very quickly. As I said earlier on, they're a very large, flabby, fluidy filled animal with a really small skeleton. And they become dehydrated super fast. If we give them an anesthetic, if we give a rabbit an anesthetic for the smallest of things, say we're taking some x-rays or we're doing a dental procedure, which may take us anything up to about half an hour, we will give them fluid therapy. Just like what you will have if you've gone for surgery yourself, they will hook you up to a drip. We will do the same type of thing for a rabbit as well. We want to keep their hydration status up. We want to keep those intestines moving. We want to keep the motility going, and we want to keep them nice and as normal and as happy as possible. When the rabbit wakes up, we will provide familiar foods. We will wake the rabbit up in its hutch, in its hospital kennel, with food around it. We will keep treats in there. This is where I go away from everything that we've talked about before, and I'll say naughty things. We don't want foods that are really high in sugars. Rabbits do like a little bit of apple and a little bit of carrot, and I want them to eat something, so I may give them a small treat of that. If you give them something that they're interested in, be that a corner of a digestive biscuit, it's got a bit of sugar in there, it's got a bit more taste, it's something that they might want, it'll encourage them to start eating the more familiar foods that they're used to. And we want them to voluntarily to start eating, so that we're not having to assist feed them for a long period of time, or even discharging them and teaching the clients how to do that as well. But if the rabbit's saying, I don't want to have anything to eat, we will go through supportive feeding, and we will throw them through it at this point. Next slide, please. So what do we do in practice? We are very lucky where we are. Myself and Molly work within a multidisciplinary hospital where they see all different species, and we see lots of different exotic species in the clinic. And sometimes keeping every variety of every type of food is very difficult for us to do. So if we know we've got a patient that's coming in to see us, and this is a pre-arranged appointment for it to be seen, I will give the owners kind of a shopping list, let's say, of things to bring into the practice, something that's familiar that the rabbit's used to. I will ask them to bring a pack lunch. And the reason for the pack lunch is because this rabbit may be a big fan of mint, and I've not been able to get mint in the local supermarket that day when I've sent somebody out. So it's there and it's ready for the rabbit to use. It means that the rabbit has familiarity for what it would normally have. It means that it's something that it's kind of used to having while it's in a more unusual environment, and we're able to tailor then what the owner's brought into that individual patient. Being at the vet is very stressful, and any normality to the patient's routine is something that we will try and keep in. I will try and, to the dismay of our practice manager and the management team, I will try and keep all of the rabbits' carry boxes with them. This is something that smells at home, that the rabbits felt safe in, it's traveled in to see us. And I will use that as a smaller enclosure within the larger enclosure that we place them in. But when I do that, we turn it at a 90-degree angle to the entrance to the kennel. And the reason for that is because it gives the rabbit somewhere to run into to hide when I go in to do something like, I don't know, check its heart rate. If we place it so that the door faces the front door of the kennel, that just gives the rabbit a smaller box inside of a bigger box, and the stress levels stay high at that point. We want them to be able to get away from us. They want us to be nice and happy, and we want to reduce those stress levels, because reduction in stress and having a good diet on board will speed up the recovery that we will have. Next slide, please. So how are we going to assist feed? So what a rabbit skull looks like, and the rationale I've put that there is to just kind of show how rabbit's dentition works. So rabbit, the teeth that you will always see, and in some instances we will know when there's a dental issue, is the incisors, which are the teeth at the very front of the mouth. They have 2 incisors on the top and 2 on the bottom, and behind the 2 incisors on the top they have what we call peg teeth. These will overgrow if they're not able to align themselves correctly. And the reason that they will not align is usually because we've got an issue with the molars. The molars and the premolars are the teeth that we can see at the back. There's a big hole that is in between those incisors and those molars because rabbits don't have canines. So that big hole there, I'm going to say it wrong, so I'm going to ask Molly to say it. What's the hole called, Molly?
Diastema.
Yeah, I always say it wrong, so I'm just not going to try it.
You were thinking I was awake.
So this is the diastema, or it's the syringe hole. It's the bit that the syringe will fit straight into, so we can give medications and we can give some food. Rodents don't have canines, rabbits don't have canines there, and that's a nice little evolutionary thing which works really well for us as the veterinary professionals and for owners. Next slide, please. So I'm actually going to go to my notes for this one. Science Recovery Plus is a really good diet. It's the diet that we use within practice. It comes as a dehydrated, nutritionally complete food, and we add a amount of fluids to this. It's based upon the Timothy Hay and it's really high concentration of long fibers. And as Molly discussed earlier on, long fibers are needed for gut motility to make things move through. It's got a really high crude fiber content, so 25% of that is within there, and that promotes GI health. It's got prebiotics and it's got probiotics, which are included in there, as well as multiple vitamins. The benefit of the Recovery Plus regarding the recovery is it's got added vitamin C. And as Molly discussed earlier on with the vitamins, vitamin C is needed for helping when we're in stressful situations or when we're recovering from surgery. It's also got other things in there as well, which really help. So there's echinacea for the immune system. There's chamomile, which kind of reduces any stress levels. If you think about it, what we will have in our herbal teas and our remedies and mixtures and stuff, you will have them. The food that we're going to give, we're going to make that up and we're going to offer it to the rabbit, and we're going to give that through the syringe. But rabbits will also take this from a bowl as well. So once you've got the rabbit on it, you're able to get it onto the food. It smells really good. They're really interested in to take it. And if my memory serves me correctly, the next slide is a video showing how to actually give an assist feed. And this is a patient that was in for dental surgery who wasn't very interested in some food once we've had it done. Are you ready?
So this little man has had his dental today, and we're just going to give him this feed. He's come out from his anaesthetic fine. He's nice and bright now, but he's not really interested in some food. So the first thing we do, just because it's kind of cute, is we pop a bib on him. The bib acts as 2 things. It kind of just holds all the food away from them. So if they do manage to spit it out and kind of drool it out on themselves, it gives it somewhere to kind of fall on, but it also gives them a little bit of kind of security and things when we're doing this. So the food is already made up and prepared. It's a dry food that we mix up with water, and what we do is we just go straight into the mouth like so, give a little tiny bit, and then let them take that and swallow it. But yeah, we're going to work our way through the 15 mils. I'm actually going to try and give about 20-25 mils, and get him home later on today on some medication. Hopefully he'll start eating on his own, but this is just to prevent gut stasis from happening.
So that was a very, very, very good rabbit that was willing to be filmed. We placed the baby bib around the neck. Rabbits have got this inherent thing where they will hold the food inside of their mouth, and then after they've got 5 or so mils, they just go bah, and they spit it all out, all over the paws, all over the dewlap, all over me. And this just helps them, protects that, and it covers that area. It also means I'm not having to bath rabbits quite regularly to do it. If you don't have bibs, if you just use a towel, you roll it over the front paws and around the back, kind of around towards the back of the head, it just provides that area of kind of safety. So we've got something to catch that food. You may have noticed as well, I only gave about a mil and a half of food at that point. Then I let the rabbit relax back down into its normal position, watch to see if he started chewing, which he did, and he swallowed, and he took that food on. Assist feeding rabbits is not a quick task. This is something that we will do on a daily basis. We are lucky enough that we see rabbits all of the time, so we will do this every single day. And to get 15 mils of feed into a rabbit can take 10 minutes to do. So if I'm giving 30 mils, I'm putting aside 15, 20 minutes of my time. We put the radio on really quietly in the corner. We sit on the floor. We place the rabbit nice and comfortable on us, and we just go ahead and we give that food. There's 2 ways that we can restrain the rabbit for this procedure. This guy was awesome, and he just sat there for me. But the back end of the rabbit, so the rump of the rabbit is rested against my chest. So the rabbit can't go backwards. There's nowhere for him to go that way. The way I had hold of him is having both of my arms on his side, on this kind of the side of his body, which made him then feel he can't go sideways. So the only way he can go, which is a safe way for him to go, is forward and to get away from me. Alternative to that, you can do it on the floor. Kneel on the floor, rabbit between the legs. And then the only way of escape is for the rabbit to go forward. This means the rabbit has got an escape route if it really does not like what we're doing to it. It wants to get away from us, but it also means that it's safe and it's secure and it's wrapped up and it feels like it's being kind of swaddled. I'm not a huge fan of wrapping rabbits really tightly in blankets or towels. I fear that they will twist and they will damage themselves. And if they twist around inside that towel, you may not notice it because the head stayed in more of a central position. Next slide, please.
So this one.
What's me again? There we go. So what do we do to get ready? We prepare the product, we get it ready, we get all of our equipment that we need first. Use the best size syringe. The recovery syringes by Supreme are probably the best syringes that we've got out there. They've got a really nice big end on them, a nice big lure on there. If we try to use a normal syringe, let's say a 5 or 10 mil syringe, the very end that the fluid would come out of blocks up really, really easily. So get hold of some of these Supreme syringes. Most of your vets will have them. They also come if you buy multi-packs of the recovery food. They are in there as well. Give them a wash. They can be reused multiple times if need be. It might be a good thing as owners to just have one in the drawer just in case we need it. Go somewhere quiet and comfortable where you're not going to get distracted. Use a towel or a bib and then get your patient nice and comfortable, nice and relaxed. Don't fight and don't do things where the animal's going to get too stressed. Go slowly. Check to make sure that they're swallowing and just be patient. It's actually quite nice after a busy morning in clinic where everything's been crazy. This is a nice 15 minutes to kind of take things back and just do it. I will also flush as well with a ml or 2 of fluids afterwards, just to make sure that there's no food around the mouth. And if there is food that has managed to dribble out and drool up and it's over the mouth, give that a good old clean, get that dried food off there. The last thing that we want is the rabbit to be able to smell that food at all times because it will make it averse to wanting to be fed in the future and it will stop it from eating the normal food that's there. Once it had the assist feed, pop it back into its environment with all of its normal food that it would normally have. Hopefully that will encourage it to start eating. By getting food into the system, it gets the stomach to start working and it starts to move through. It gets the motility of the guts to start to move and we get feces eventually starting to pass through there. With assist feeding, rather than with its general feed, you will notice that the feces are slightly different. The patient will be dehydrated when we've started to give the assist feed, so the feces have started to dry up a little bit, and you will notice it will be smaller, darker, and sometimes a little bit spiky and a little bit uncomfortable, which again is uncomfortable, which is why we talked about giving analgesia. But we can also give medications as well if need be to actually encourage them and give energy and power to the motility to make them move through. Next slide, please.
So finally, what we can look at is using food as support for diagnosed clinical conditions. And I think it's worthwhile just saying here at this point that if you are concerned if your rabbit has something wrong with it, that condition needs to be diagnosed and then appropriately treated. Food on its own is not a substitute for treatment. However, there are supportive diets available for various clinical conditions. These are not prescription diets. And I think it's worthwhile noting that every individual that is suffering from various different conditions could potentially benefit from a suitable diet. Now, a suitable diet in most cases is one that supports the gut motility, supports the animal being mobile, it supports the immune function, as well as in some cases trying to target specific issues. For example, using cranberry juice to stop bacterial adhesion in the bladder for animals that have cystitis. So that would be a reasonable example. if you're going to consider using some of the supportive diets or food additives for specific conditions, just be aware that there can be potential side effects and drug interactions. And there are a variety of supplements that are available for rabbits. So certainly definitely check with your vet before adding any of these in. One, you know, when we're looking at pelleted food in particular, the strategies that the food companies are likely to use are certainly adjusting the amount of calories that are available, adjusting the amount of fibre that is available within the diet, certainly restricting the calcium, and that is very important that an animal has enough but not too much, so that we're not reliant on the kidneys for removing that, for example, in an older animal. And other things you might find is that there are additional supplements, such as I said, cranberry juice or additional vitamin supplementation. But again, it's certainly worthwhile understanding that food can support clinical conditions, but food should not be used as a substitute for a specific treatment. So I think we need to finish there, and I would hopefully speak for Craig as well to say thank you very much, everybody, for attending and listening, and then ask Claire and Julie to invite any questions. Thank you.
Yes, thanks very much, Molly. Thanks, Craig. I thought, Craig, it was very interesting what you were saying about assisted feeding and making sure you clean the rabbit afterwards if any food is spilt around. That's certainly not something I think we've got any in any of our advice literature, and I definitely want to update that, because I think that's quite important that people know it can put the rabbit off from getting their appetite back. And Molly, I think I really want to reiterate your point about seeking veterinary advice. I mean, you know, we provide different diets, and diets can be supportive in helping rabbits that have issues. But if you ever have any doubts about your rabbit's health, I really think it's so important you seek veterinary advice straight away, particularly when it comes to gut motility issues. We've got a few questions coming in on the Q&A, and I'd invite anybody who would like to take part, please just post your questions on the Q&A, and I will run through what we've got here. Molly and Craig, if you could answer some of these. So Joanne Barkley has said, I have rabbits that absolutely refuse to eat hay and have been offered a variety of hays, Timothy organic, botanical, etc., but they still refuse. Are there any suggestions? So far, no dental issues and poop output is perfect.
So I would, with rabbits like that, I think things like the fibre first pellets, those types of pellets with a lot of long strand fibre can be helpful to get those animals used to eating hay. The other thing that I would do is actually get them eating freshly picked grass, because grass is extremely good at wearing down the teeth. So we're sort of slightly taking the anxiety away from having to have hay. And certainly if you start feeding grass in the summer and progress that towards the winter, when it starts to get a little bit drier and a little bit more fibrous, that can also be helpful. The other top tip is to start getting hay mixed in with other things that the rabbit enjoys eating, and have it in the litter box area, because they do tend to nibble and pick while they're on their latrine, and again, it can be a useful method of trying to get them to eat it. Having said that, we still, all of us have some of these animals that will just not eat it, and we can only do the best that we can do, and there shouldn't be any kind of guilt associated with it if they just won't.
Yeah, no, that's great. Thanks, Molly. And just another pointer, we do have a fibre first diet, which is a very long strand hay pellet, which can be quite useful for encouraging those rabbits that don't eat hay to get some more hay in their diet. Diane Caroline was just asking about neutering, and that bunnies should have less calories. That's correct after neutering, Molly, yeah?
Yeah, yeah. Sorry about that, but yes.
No, that's fine. I think they just missed part of the talk when they were writing notes. So syringe feeding, Suzanne Reed is asking, do you give a set amount per feed depending on the size of the rabbit? Probably one for you, Craig.
Yeah, we normally give we try for 15 to 20 mils per kilogram. The Supreme sachets that come, if you make up a whole sachet of them, you add, I think it's 90 mils of fluid into that packet. You can store that in the refrigerator, and that can be happily used for the next 12 hours. And the instructions off that say that we should give 20-gram sachets per kilogram of body weight. So you'd use 3 sachets a day, for instance, for a 3-kilo rabbit. We will normally give an assist feed every 3 hours if we can get 20 mils per kilos on board. It's not as important to feed throughout the night as well. I'm not going to ask our clients and our rabbit owners there to be getting up at 2 and 4 o'clock in the morning to be giving feeds. We need to be reasonable on that as well. But hopefully we shouldn't need to do it for too long, because the rabbit should start taking food on. And you can leave that bowl with the rabbit, and hopefully they will start eating the food from the bowl as well.
Excellent. We have a question from Verity Ann saying, do supplements like turmeric help rabbit joints like they can in humans?
So I looked into this probably within the last 12 months, and there are some evidence it's starting to come through from laboratory testing to suggest that turmeric and that kind of thing can help. However, it's not as defined as it is in humans. And I think we also need to remember that things like turmeric are actually quite potent. So we need to be reasonably careful with it. What I had not found was any evidence that there were negative effects of turmeric. So I think that, you know, we couldn't definitely say, yes, it's going to work, or going to be helpful. But at the moment, as far as we're aware, it certainly doesn't hurt.
Thank you, Molly. Jennifer Hughes is asking about the portion size that should be fed to rabbits, and asking about the ear-sized amount, whether it should be fed once or twice per day. But I think we need to caveat that in terms of the size of the rabbit.
The size of the rabbit's ears, yeah. But it would be once a day though, Jen. I know they've got 2 ears, but yeah, just once a day and just a small amount. We can also go the old school ways that you just offer pellets of an evening as well. So it gives the rabbit the choice to graze throughout the day, and then it can fill themselves up on the pellets at the end of the day if that's what they require to do. Great,
thank you, Craig. Karen Alexander is asking, is kale a good veg for rabbits?
Yes,
yeah,
sorry, I was going to say yes in moderation.
That's exactly what I was going to say.
We've worked together too long.
As part of a balanced diet, there is no problem with giving rabbits kale. However, it is reasonably high in calcium, and those rabbits that are having some mobility issues or some bladder issues, it might well be worthwhile limiting it. Same goes for spinach.
And that's interesting, leads us nicely on to the next question from Tiffany, asking, how do we reduce calcium intake?
So again, in terms of calcium intake, we need to look at the type of hay and the type of greens that we feed. And certainly when we're looking for a lower calcium hay, we're looking for things like meadow hay rather than anything else. And we then need to be quite discriminating about this type of vegetables. So things like kale, things like spinach are reasonably high in calcium. So while they can still be part of the diet, they shouldn't be a major part of the diet. And there are, you know, quite a lot of resources on the amounts of calcium in various types of veg. And so we need to just choose within our variety of veg, those that have lower calcium levels. But what we shouldn't do is start messing with the pellets, because you need a background amount of calcium. You can't remove calcium from the diet.
Yeah, and I'd just like to add to that, actually, Molly, I think that's a very good point and ties in nicely with another question we've had about the best types of hay and Timothy hay versus alfalfa. Whilst you might want to avoid feeding a hay like alfalfa to reduce calcium intake and focus on a Timothy hay, with the pellet part of the diet, and we certainly would do this with all of our foods, is that the calcium phosphorus levels are balanced to the correct levels, regardless of what type of hay is in the pellet. So there is a difference between how the pellet and or the hay could be viewed in terms of calcium intake. So just moving on to Laura Hayes is asking about supportive feeding. How many mils per kg and how frequently do you use?
15 to 20 mils per kilo and about every 3 to 4 hours.
Excellent. Okay, Paisley's asking about a rescue rabbit that was severely malnourished and has just got up to weight. They want to get their rabbit neutered. So they're just saying, would his diet be different after, due to the nutritional issues at the start of his life?
Yeah, I think that might be an animal that will have more challenges as its life continues, because it has been nutritionally deficient. And as we said, actually the start of a rabbit's life is actually quite a critical period. So if there are deficiencies there, they need to be addressed and sort of made up. But we do need to remember that the gut function, the tooth production, and things like the immune function will likely have been affected. And without knowing exactly what the deficiencies are, you can't really comment more on that other than to be vigilant, I think.
Great, thanks, Molly. Amanda Carter is asking about any tips you have for weight loss.
Lower calorie pellets, calorie restricted pellets. The trouble that I tend to find actually is, you know, people say, oh yeah, we'll stop the pellets and what have you. I have certainly rabbit patients that seem to gain weight on only eating hay and water. So it might be a combination of a slight restriction on the volume of food that that rabbit has access to, as well as using some of the strategies that Craig mentioned for getting rabbits active. So using their food as environmental enrichment, getting them moving around and that kind of thing. But it will be a combination of dietary restriction, slightly, carefully, as well as increasing exercise and mobility.
Excellent. Amanda King is asking, she wants to move her rabbits from a muesli to a pellet diet, but they're absolutely refusing. Any advice?
Again,
ways. I would keep trying.
Sorry, I was going to say 2 ways to do it. Keep trying by maybe mixing them together, maybe doing a 50-50 for the rabbits to eat them. But as we said earlier, we are a nightmare for throwing things away when we don't think the rabbit's going to eat it. Alternatively, offer them a small amount of pellets to eat throughout the day, and of an evening as a last thing, offer them some muesli. So if they've not had enough nutrients, they've not filled themselves up, they could have the muesli of an evening. But do that for maybe a week, then half the amount of muesli, and then stop the muesli another week later.
Excellent. Are there any foods you can recommend for improving bladder sludge? Asked Verity.
I'm sorry, I didn't catch that.
Sorry, any dietary recommendations for improving bladder sludge? Again, that would tie into the recommendations for reducing calcium intake, I guess.
Yeah, absolutely. Improving mobility and reducing calcium intake, and making certain that any underlying conditions are attended to.
Great. And Lorna is asking, I see a lot of conflicting information on the benefits of pineapple to help break down fur that's been ingested. Is this the case or simply nonsense?
I think rabbits really like pineapple juice, but we have to remember that there is no evidence, there's no scientific basis to suggest that pineapple juice that you buy from the store, which has been pasteurized, so therefore the enzymes are not active, will do anything other than give your rabbit a hit of sugar. And quite often, actually, it works because it's given a hit of sugar, but it will not digest the fiber in the stomach at all.
You'd have to make your own pineapple juice for that to potentially work.
Right, excellent. Okay, and I think we're sort of getting to the end of the session now, so I'm just going to finish on one last question, Molly, before we say thank you very much. I certainly want to say there's a huge amount of feedback from everybody saying thank you to you and Craig. So just time for one last question. I'm struggling to visualize an ear's worth of pellets. How does that translate to a tablespoon, egg cup, etc. of food? I've seen recommendations of anything from 5 to 30 grams per kilo of body weight.
5 to 30 grams is what the textbooks say, yeah. I'd go smaller, I'd probably go the lower end of that, probably go 5 to 10 grams per kilo. We want to keep the pellets down to a smaller level and have them more on a hay-based diet if possible.
Yeah. Yeah, I think as well, a lot of that in terms of the volume size of how much you feed depends on the bulk density of the food that you're feeding and also the size and weight of the rabbit. So I think perhaps I would suggest as well the next time your bunny's in seeing the vet, to have a discussion with your vet about that. So I just want to say, yeah, big thank you to everybody that's joined us today. And as I say, Molly and Craig, we've had some amazing feedback. Everyone's really enjoyed the webinar today. Just to confirm, there will be a recording of the webinar available, which we will email a link out to everybody next week. And if there are any questions that we haven't covered, you can always contact experts at supremepetfoods.com and we will attempt to answer any questions we haven't answered today. So thanks everybody, fantastic, really enjoyed it, and enjoy the rest of your Rabbit Awareness Week, everyone.
Thank you for joining us, guys.
Thank you.
Thank you, guys. Bye. Bye.